A lipoma is a benign fatty tumor. They come in all sizes and usually lie beneath the skin in the subcutaneous tissue, but may penetrate the muscle or lurk beneath it. This giant lipoma is beneath the left axilla. The lipoma consists of a fibrous shell or sac filled with dense fat. Some lipomas consist of multiple smaller lipomas fused together. It feels firm but mobile, with smooth, rounded edges. It is not fixed or stuck to the surrounding tissues. There are no suspicious lymph nodes. The conventional technique of removal is to make a long incision directly over the axis of the lipoma. The incision is carried down through the subcutaneous tissue until a giant egg-like mass is encountered. The tumor is easily freed up from the surrounding tissue and removed in one piece. Unfortunately, this results in large, unsightly scars and sometimes painfully prolonged recovery. There is a better way. The lipoma is injected with a solution of short-acting and long-acting anesthetics diluted in normal saline until the lipoma is bloated and tense. A small stab wound incision is then made along the periphery of the fatty tumor, about 1/4 of an inch in size. A small diameter liposuction cannula is placed through the stab wound without suction and used to break up the fat and loosen the tumor sac from the surrounding tissue. A large diameter liposuction cannula with 3 openings in the tip is now inserted, again without suction, and the process of breaking down the fat and freeing the sac continues. Without suction, the edges of the sac can be felt by the surgeon as he separates the tissue. Now, suction is turned on and the loosened fat is progressively sucked out of the lipoma. As the cannula is passed back and forth through the center of the tumor, the fat breaks down and is sucked out. When most of the fat has been removed, there still remains the fibrous sac, which can easily be seen clumped beneath the skin. Here it is moving around at the tip of the cannula as further dissection is performed. The sac now is grabbed with a clamp and pulled out until it can be secured with a second clamp parallel to the wound. This clamp is then turned as if rolling spaghetti on a fork. The strong, fibrous tissue is compressed as it is forced through the opening and decompresses as it comes out along with some residual fat. The remaining attachments of the sac to the underlying tissues can be seen breaking loose through the skin as the sac is removed. Notice there is no bleeding, no bruising, no swelling, no pain. A single suture closes the stab wound and a steri-strip is applied. 1 week later, the patient has her suture removed. Again, notice there is no bruising, no swelling, no pain. But most of all, there is no hideous scar. Sure, the long incision along the axis is conventional treatment. But now you know there is a better way.